Everything starts with a pap test. Georgios Nikolaos Papanikolaou, in 1943, became known for his invention of the Papanikolaou test, commonly known as the pap smear or pap test, which is used worldwide for the detection and prevention of cervical cancer and other cell biology diseases of the female reproductive system. Pap test. What comes to mind when you hear the word pap test? What is a pap test? Who does a pap test? Should I have a pap test? When do I get a pap test? What happens if my pap test is not normal? All of these are questions that women around the world ask at some point in their life. Well, not all women. In some countries, basic pap tests are still not available. 34 million people live in Canada, 17 million of which are female. That means 10 million women should be getting a pap test. We are not really sure how many are. What we do know is that every year, 400,000 women receive the news that their pap test is abnormal. The odds don't sound so bad, but if you are the one getting the news, would you know what it means? Or would you know what to do? The following video will cover what happens when you get a result that is not normal. Some people usually say, your pap test is abnormal. To watch a video about pelvic exams and pap tests, visit the link at the end of the video or look up My First Pelvic Exam.
Hello, Amy. I'm Dr. Brian Houck. How are you today?
Oh, I'm a bit nervous.
Well, that's okay. No need to be nervous. If you have any questions as we go along, I'll explain things to you. So I'm a colposcopist. Now, firstly, a colposcopist is a gynecologist who has extra training in colposcopy. Colposcopy focuses on the screening of abnormal cells in the cervix. So if you're coming to see me at this type of clinic, it's because you've had a pap test that's not normal. Now what that means is that when you had your pap test, some of the cells taken under the microscope didn't look as they should. Sometimes these abnormal cells can progress into a cancer. So you're here to see me to determine what the problem is, the treatment options, and how to deal with it. So the first thing I want to show and explain to you is the equipment that I'm going to be using. So this is a colposcope. Think of it as a very large microscope. It allows me to examine the cervix and vagina very closely. As I'm looking, I'll take a sample of cells, and this is called a biopsy. The instrument that I use will be a biopsy forceps.
Does any part of that machine go inside me?
No, this rests entirely outside of you.
Will it hurt?
So no, mostly it feels uncomfortable. It's very similar to a pap test. You will get some bleeding and discharge for a few days. You can take any of the over-counter painkillers you want. And it's also important to avoid intercourse, tampons, or putting anything into the vagina until the discharge is stopped.
Then what happens?
Well, the cells and tissue from the biopsy are then sent to the lab. It'll take about 3 weeks to get the results. Then, depending on what they show, I'll decide what the next step or treatment is. So you'll get a call in a few weeks from the clinic and to schedule the next appointment, which is usually between 3 and 6 months.
Are there different kinds of treatments? Do you get them in some sort of order?
Well, that's a great question, Amy. The most common treatment is a LEEP, which is a loop electrosurgical excision procedure. So you see this fine wire? An electrical current goes through that fine wire. And as I pass it over top your cervix, it removes the abnormal cells. The whole appointment can take about 10 minutes, but the LEEP only a few seconds. There, again, afterwards will be some bleeding and cramping afterwards. There may be some discharge as heavy as a period that can go on for up to 10 days, and that's normal after a LEEP. Again, it's important to avoid sex, tampons, or anything in the vagina for about a month.
And what are the chances that I would have to come back for another treatment?
Well, that's really hard to say at this point, Amy. It all depends on the individual, but the majority of times, one LEEP clears it all up.
And what happens if it doesn't clear up?
Well, then we would have to continue the treatments until it was cleared. Now, if I did determine that there were some cancerous cells, then I would be sending you to a gynecologic oncologist.
I've never heard of that type of doctor.
I'm not surprised. There's only about 100 of those kind of doctors in all of Canada. Now, they're a very specialized kind of doctor that deals with the treatment and care of gynecologic cancers. These are the cancers that arise from the women's system or the origins from the female reproductive organs.
Thanks for all the information, and thanks for having met me.
Oh, you're very welcome, Amy. So you'll be getting a call in a few weeks with the results and then your next appointment.
Okay, great.
We know now what a colposcopy is, what a colposcopist does, what a LEAP treatment is, and what a gynecologic oncologist is.
I'm Dr. Monique Bertrand.
Hello, Dr. Bertrand.
I understand that you were referred by Dr. Hauk. I believe you saw him a few times in the last year.
I had 3 LEAP procedures done last year. When I saw him, he recommended that I come to see you.
Did he explain to you why he wanted me to see you?
I thought I did, but I'm not so sure now. He did explain to me what a gynecologic oncologist is and what that means. He did mention that you will conduct procedures that he can't perform. I don't remember. Oh, yes. He told me that I wouldn't be able to get rid of my abnormal cells. I should have taken some notes.
Let me clarify a few things for you. Gynecologists and gynecologic oncologists do several of the same procedures depending on their experience. The main reason you are here today is because your doctor was worried that cancer could be involved. There are 3 different treatments that are possible depending on your case, and I will describe these in detail. The first treatment is called a laser treatment. First, I would look at the cervix to see if there are any abnormal cells. Then I would freeze the cervix, and this will feel like when you're at the dentist. Then, the last step, I will vaporize the abnormal cells and essentially clear your lesion. The second treatment, or the second type of treatment, is called cryotherapy. With this treatment, we use a small probe called a cryoprobe. We put it on the cervix for about 5 minutes. This freezes all the abnormal cells, and the abnormal cells are then washed away in a watery discharge. This procedure is not used very commonly in Canada. The last treatment is called a conionization or a cone biopsy. This is a treatment but is also a test because we can use it to identify cells that we could not find with the other methods. Initially, we also do the same thing. We look for the abnormal cells, but this procedure is done in an operating room under a general anesthetic. We use a scalpel, a knife, to cut the lesion in the shape of a cone, and then we send the specimen to be analyzed in the laboratory. Sometimes, though, we have to use stitches to stop the bleeding, but usually it's not a problem.
Will I have to come back after this treatment?
Yes, you will have to come back for 2 follow-up visits. These are very important because I will want to make sure that the abnormal cells are completely gone and also that the cervix is healing well.
How successful is the treatment? Is one treatment more successful than the other?
No, there's no treatment that is better than any of the others. All 3 treatments are equally as effective to get rid of the abnormal cells. It's essentially like using 3 separate ways to get to the same destination. But after the treatment, most women do not have any problems with any residual precancer cells.
Will I be able to have children?
Yes, you will be able to have children. The treatments do not affect your capacity to become pregnant.
What happens if the treatment doesn't work?
The next phase then would be to treat this as if it was a cancer. However, I don't think you have to worry about this at this time. You are very far away from that point, and the probability that you will develop cancer is very, very low.
Why did I get abnormal cells?
Abnormal cells are usually caused by the HPV virus or the human papilloma virus. Both men and women can get the HPV virus. There are 150 different types of HPV. Some types cause an infection that, in most cases, clears up on its own. These are called low-risk HPV types because they are not associated with cancer. However, some infections that do not clear may lead to precancerous cells, which then lead to cancer if left untreated. These are called high-risk HPV types because they are associated with cancer. The 4 HPV types most commonly associated with cancer are HPV 16, 18, 31, and 45. Women can get cancer of the cervix, and men can get cancer of the penis. As well, for both men and women, 10 to 20% of cancers of the head and neck are also associated with HPV infections. Cancers of the anus, vagina, and some cancers of the vulva are also associated with the HPV virus.
How did I get the infection? Can I prevent it?
It is estimated that at least 80% of men and women will get HPV at least once during their lifetime. It is spread by skin-to-skin contact, even during sexual relations without penetration or during oral sex. You can't really prevent it, but you can make changes to minimize your risk of infection. You can use condoms, which will offer some protection, and you can also use the vaccine, which will protect you against the high-risk types of HPV.
Can I still do that, even though I've had an abnormal test and treatment?
Yes, you can. You should contact your healthcare professional to make arrangements to obtain the vaccine.
Does the vaccine contain the virus?
No, the vaccine does not contain the virus, and therefore you will not get infected with the HPV virus. And don't forget to have your Pap test done every 2 years or as recommended by your doctor.